Welcome back to Ripple Effect Connection. I'm your host, Kristi Hujik. I am a level 3 integrative health practitioner and a certified international health coach. My purpose with this podcast is to connect you with the message and the messengers of life-changing and empowering information. This episode is all about navigating the wild world of supplements. And if you've ever felt totally lost in this area, or if you've cultivated what I like to call a supplement graveyard, this episode is absolutely for you. The supplement industry is massive, confusing, and full of noise, which is why I've pulled in my good friend, Dr. Allan Sidorsky, to help us cut through the chaos. Dr. Sidorsky is a repeat guest on the podcast, but for those of you who don't know him yet, his journey began with an undergraduate degree in physical education, kinesiology, and he was driven by a passion for holistic well-being. He went on to study chiropractic medicine at Palmer College and trained alongside experts in athlete care, always staying up to date on the latest advancements and therapies. With his deep knowledge of the body and collaborative philosophy, he is truly one of the most knowledgeable and caring practitioners you will ever meet. Today, Dr. Allan and I are not giving you a scripted lecture. This is a real off-the-cuff conversation where we tackle some of the major do's and don'ts in the world of supplementation. We dive deep into the specific details you need to know. Where's the line between taking too many and too few supplements? What are the 2 foundational supplements nearly everyone needs? Why should you avoid the trap of the latest TikTok trend? What's the difference between methylated versus unmethylated bees? And we'll talk about how you can get ripped off by counterfeit supplements. It's a real thing, folks. Our goal is to help take the guesswork out of things for you. Let's get straight to this conversation. It's going to help you really navigate the world of supplementation a lot easier. Here is my discussion with my good friend, Dr. Allan Sidorsky. All right, Dr. Allan, I don't know how this happened, but somehow you got away without being on season 2. So we brought you back in season 3.
Thank you for having me for season 3 already.
Season 3 already. I know. It's amazing. I looked at it and I was like, I've been doing this for over 2 years. So I wasn't sure what it would turn into. But as long as we've got stuff to talk about, we can still keep doing podcasts.
Well, and I know I got a couple of my friends you've had on as guests, and those are great podcasts. So
Yes. I do have a couple of your friends. So today we're talking supplements. And you and I talked about chiropractic the last time. And I think what we need to do is just talk about what's your philosophy around supplements. When people come to your office, how much are you discussing supplements, and kind of what's the philosophy behind what you're telling them?
a lot of it will come down to, in terms of when a patient presents, is how they're presenting. Then there's some, I guess you could call low-hanging fruit, that are just nutrition that is not in our diets. I'm a food first person. I want people to eat their nutrition. That's the way our genetics has been programmed, is for our bodies to eat real foods. And then from there, if there's some things missing, the big ones, like if you think magnesium, obviously, is probably one of the bigger ones. Vitamin D, if people got more sun, didn't have to work inside all day, it can be sometimes just taken by getting outside and kind of grounding themselves to our environment that we should have been in. Magnesium tends to be one of the bigger ones. Both of those lead to the deficiencies in vitamin D, as well as magnesium lead to things that I see a lot, which is muscle pain, joint pain. Those are the clinical signs for being deficient in those two nutritional nutritional products. So that being said, those are kind of my go-tos. 70 to 80% of the population is deficient on vitamin D and magnesium. One of those things that a lot of people are like, oh, well, can I just eat my magnesium? I'm like, you could if you like pumpkin seeds.
I do.
Right. And those are a great thing, but it takes about a cup of pumpkin seeds to get to about 75% of your magnesium, and that would be daily of your needs. So it's kind of not going to happen with most people.
Do you see the people that come to you that have what I call supplement graveyards, where they're looking for a pill for every ill? Like, are there people that come to you that they want to keep maybe taking supplements, and you have to kind of rein them in at all? Yeah,
I mean, it's one of those things, you and I were talking about this. People want to try to get healthier. It's not an issue of people not wanting to be healthy. So you get everything from people going to like, I bought this from Costco, I bought this from Sam's Club, I bought this from Target, and I've got this multivitamin. And, is that sufficient? Is it good? Well, if it's all packed into one tablet, a lot of people will come back with those situations like, I've been taking this, but it doesn't make my stomach feel very good. And I'm like, well, are you eating? They're
Mm-hmm.
like, well, what do you mean? I'm like, are you taking it with food? And they're like, well, no. Like most of the times, if you're taking multivitamin, which is not usually my preferred recommendation, depending on the person, on an average patient, is not to throw a big multi-supplement at them, is to kind of try to tease out which
Yeah.
ones they need so we kind of don't overwhelm the system. Otherwise, you're just making urine and your defecation more expensive than you need to by taking things you don't necessarily maybe need, and or even worse, possibly causing a problem. One of those examples is, and probably people have heard about this, is the methylated Bs, right? With unmethylated B, like if you can't methylate and you're taking an unmethylated B complex or B product, or possibly for a lot of people that B is in their multi and it's not methylated, they're having problems. And the problem is because they're trying to get better, but yet stacking a problem on top of their methylation problem. Like they don't have the genetics to basically methylate it. So they need a methylated product, not the unmethylated product that's coming in at a much lower price point on some of these vitamins.
Yeah, I mean, you touched on a lot of things there that I think one thing that I have seen in my experience being at the clinic, if someone's dealing with an acute issue that you're trying to help, you sometimes need to dose it higher. And people should not be doing that necessarily on their own, right? So
Correct.
maybe the berberine dose that someone takes for maintenance or blood sugar regulation is different than if there's a gut problem. Like I was taking it 3 times a day, but if I wasn't trying to deal with a gut issue, would I be taking it 3 times a day? Probably not. Would I be taking 2 omega-3s if I wasn't addressing something in the present for maintenance? Probably not. So I think it frightens me sometimes that people are going at this on their own.
Yeah, I mean, it's I think they use they talk to their friends.
Mm-hmm.
My friend's been doing this and it worked for them. And it happens in medication as well. I mean, baby aspirin to me is one of the ones I just see people all the time. I'm like, when I'm doing their intakes and they're like, I'm taking a baby aspirin. I'm like, did your doctor put you on that? And they're like, no. I'm like, well, why are you taking it then? And they're like, well, I heard, right?
I heard.
I heard.
I heard.
And it's one of those things that it's great, except, NSAIDs, of which aspirin is in that category, all NSAIDs are hard on hypertension and your heart. And so whether it's ibuprofen, whether it's aspirin, whether it's naproxen, they don't come without side effects. Some of the numbers on gastric bleeds kill about 60,000 people a year. And then everyone says, well, I just take Tylenol. Well, again, this is about nutrition, but people forget there is side effects to everything you put into the system, right? And some of those side effects are good, and we use those both nutritionally, and I know a lot of my medical doctor friends use those side effects, gabapentin being one of them, right? They use the side effects of the medication as the treatment, right? Off label, which a lot of times patients don't understand the ramifications of what they're getting into when they start kind of like, well, my friend was taking this, so I thought I should take it because they had good response. Maybe, but maybe not.
Yeah. And I think it is. I've been in conversations with some of my friends talking about this and hearing what they're saying. I do not make it a secret of one of my biggest supplement rules, which is do not buy your supplements where you buy your toilet paper.
That's probably a good one.
So I think like maybe we can give them some parameters. Let's just say they are going on their own. There's people that are going to listen to this and they're not working with a practitioner. They're not coming in your office. So that's one of my rules. What are some rules that you would give them to kind of help them kind of pare down what they need and don't need?
It's at least to have the education of so your fat soluble vitamins versus your water soluble vitamins. Your fat soluble vitamins can cause trouble. Your A, your E, your vitamin D, right? You can get to doses that are too high. Usually most people don't, because of what the RDA has put out there. But like even for a water soluble vitamin like vitamin C, for example, it's 60 milligrams per day for vitamin C is really kind of what they say you need to, and that is to prevent scurvy, right? You eat a couple oranges, or, like the British sailors used to do. The reason they're called limeys is because they put citrus on their ships to prevent their teeth from falling out from getting dietary scurvy. But is that optimal function, right? So a lot of times we need to look at end products of whether it's labs, or whether it's, certain, are we chasing symptoms? Are we looking for optimization? Those are the types of things and certain functions. Like my 2 big nutritional for myself are D and magnesium, like we talked about. Those are my go-tos. Everyone's deficient in it. It's kind of the low-hanging fruit. The RDA, they may have changed it. It was 1,000 for vitamin D. It was 1,000 IU. I think they've moved it to 2,000, which is still relatively low because still most people are missing the mark on that. The prescription strength for vitamin D come in 2 different ones. Is 25,000 IU one time per week or 50,000 IU one time per week. And people are like, oh, that's a lot. I'm like, well, so if you divide that out by 7, you're in the 6,500 plus, right? And some of those people still aren't hitting the mark. And once they hit the mark and their labs are normal, they usually get taken off of it.
Right.
So I don't understand that logic, but again,
off of it completely.
Completely.
Not even like a lesser dose. Like,
Correct.
hey,
They just
okay, we're
have-
going to give you 5,000 IUs for maintenance.
No, it's just we're going to
It's
stop.
cold turkey.
Yeah,
Stop.
which I don't like because again, the lab's good. Great. Are you treating the lab or are you treating the person? And that comes down to, I mean, we all sometimes fall into that trap of do we treat the lab or are we treating the person, right? And you got to remember that lab is somehow attached to that person. And some people's labs are going to be a little bit, if it's not all a perfect science when it comes to labs, even lab, you get a blood draw and it's 2 different facilities, you can have numbers that come back different that you're sitting there like, why is it different? Was it drawn the same lab? Well, there's error in everything, so where we're looking, we're trying to get an idea, and that's a point in time, right? So at that point in time, you may have been at this level and a couple hours later or whatever, if another draw gets done, it could be different.
You touched on magnesium, which, yeah, I would agree. Like those D and magnesium is almost like almost a no-brainer. What magnesium are you? They're going to ask about that because people have no clue. There's so many different kinds of magnesium. So what kind of magnesium are you usually doing, and what should someone at home be considering when they're thinking about magnesium?
The stuff that you would find kind of where you buy your toilet paper is going to be mostly to help you actually use your toilet paper. It's going to be a citrate. And so magnesium citrate does not absorb very well in the gut. Magnesium is rate limited in terms of absorption. So the idea is that when you take magnesium citrate, it's going to help you go number 2.
Yep.
So why that is it'll get down to the lower part of the bowel, cause a relaxation of that smooth muscle, and now you can go to the bathroom. You'll still absorb some of it. So if you're dealing with this, like for a lot of people that are so magnesium deficient, they start taking it and go like, this feels great. And usually they were constipated and they're having bowel movement. So boom, killed 2 birds with 1 stone. And it was relatively inexpensive. And it was cheap. And those are one of the ones that, again, can you buy a better magnesium citrate? At that point, it boils down to what it's bound with. So what agents in there that are keeping it on the shelf for longer? So do you want those things that are in it or not? And then not that it can't have it from, like if you're buying it from other places, everyone's like, well, can I buy it from Amazon then? Amazon had a big problem with counterfeit nutrition.
And they still do.
And they still do. And there's ways that they're trying to get by it. But again, those are not working to 100% yet. So it's kind of like you're basically taking the gamble of what you're getting because of how many people's hands have been on it in the process.
Well, I heard a story actually recently in the last 2 days. So I didn't have a chance to give you a heads up on this, but it fits into that. I always thought if you're on Amazon and you're getting it and it says shipped from, say, our friends at Zymogen that are here in Orlando, right? And it says Zymogen store. But then I heard that because of the distributor, the supplement company can't actually guarantee that it's what it says it is because it has gone through so many to get to the distributor. And then people will sometimes get their supplement and the labels outside look exactly the same as the one they wanted, but then they look at the ingredients and they're not the same.
Yeah, and there's just counterfeit stuff too. Like there's people that'll buy the bottles and print a label and put it on, and then they'll go in and encapsulate other things. I mean, we've had products that were not nutritional, but we've had topical products that people are like, I bought this the same one that you sell, and I bought it. It didn't feel the same. I'm like, where'd you get it? Like, did you get it from me? And they're like, no, I got it on Amazon. I'm like,
yeah,
right. It's again, unfortunately, we have to be aware of those types of things, and until they kind of figure out a chain of who's supplying it and where it's coming from, you have to be really kind of careful in terms of purchasing, especially things you're going to put in or on your body from those areas. I mean, I'm not positive, but I'm sure they have other issues, even with just creams and lotions and other stuff that are going through those chain. And I mean, eBay is even more the Wild West because now you're definitely buying it through somebody else's.
Yeah.
Hands.
No Costco, no Walgreens, no eBay, no Amazon. I also think too, looking at a supplement company, maybe one that's I'm talking about ones outside of Amazon, and say you're on their website, right?
Yep.
Good manufacturing practices. It'll say GMP on there. They'll tell you what allergens it's free of, because this is one that always sticks out in my head. I was taking a vitamin D. I think it was vitamin D a long time ago. And I noticed there was soy in it. And I went, what what are we putting soy and vitamin D for? Now, there's a lot of people out there that just don't know enough to look at those things, but you do want to look at the ingredients,
Yep.
right?
How it's capsuled or
how it's capsuled,
Yep.
right? And there are people, I've worked with enough people in the autoimmune world that are so sensitive too, that the capsules and or some of these binders inside of the supplements, preservatives, can irritate the gut.
And some people become so sensitive that even if it's manufactured in a similar plant,
Yep.
right, where
Mhm.
there's microparticles that somehow taint it, they're that sensitive, their immune systems are that sensitive where they have either an allergic attack or a symptom associated with taking that product. And they're like, why would I be having these symptoms? And you look back and you're like this was made in a plant
Yeah.
that also had maybe something to do with tree nuts or something to do with soy
Right.
or something to do with something in their manufacturing where they don't just make that one product, or they don't have enough, what's a nice way of saying it, housekeeping protocols to make sure that there's not cross-contamination.
GMP designation is important. And then I always like a third-party
testing. Like most of the places that I deal with, if I call the plant or the manufacturer, they can send me a third-party testing assay of what's in it. For those companies, like I said, I don't do a whole lot of brands of different things just because it does take time to make sure you research, especially when you're doing it in a clinical setting. You have to make sure that what you're giving, before anything else does no harm. And so those are one of the big things, from a clinical setting, you have to be aware of. If you're going on your own, again, you've got to be really kind of conscious about, okay, as you throw so much stuff into the soup, right? Are you getting the effect that you're trying to get? Like, what are you trying to accomplish with it?
Right.
Right. And I think, some people are just like literally throwing out for a line for help with some of the stuff that they've had no luck with. And then other people are just saying, well, I want to give, I want to buy the vitamin insurance type thing. So they're spending money just because they're like, well, if I have a little bit of this, then at least I've got a reserve of it, which is kind of like the multivitamin, like where you take the multivitamin. Oh, I just want to make sure I get everything. Okay. But at the same time, are you causing any troubles by doing that?
Yeah. And I think that we have to look at, okay, what is this person doing nutritionally? Like you said, food is first, food always comes first. And if we've got people that are struggling with eating maybe a well-balanced diet, they're going to be more nutrient deficient, and especially in the micronutrient, department. And then you've got the school of the people who, some of them are just looking for foundational support and they're doing okay, right? They just want fill in the gaps. But then there's those acute cases that we're talking about where they're desperate, right? So they're looking for the pill for every ill also factors into the supplement world. So if let's just say someone's chronic pain is a big one. They're looking for chronic pain relief, looking for maybe a non-prescription methodology. How are you treating that when someone's coming? Because you're seeing the chronic pain people a lot.
Yeah,
too.
a lot of times, like obviously turmeric is a big one for inflammation. Basically the gateway between inflammation and pain, and trying to basically turn down that NF-kappa response. Your gingers, your black pepper, bromelain, some of the stuff for like more soft tissue papain, which comes from papaya and pineapples from the bromelain standpoint. Like everyone's like, if you eat those things, you will get those things. One of the things with turmeric people don't realize is turmeric, you can increase its effectiveness by adding black pepper. And it's almost one of those things, if you're taking turmeric, you're probably better off putting a little black pepper in there with it. And if you can cook with it, great. Some people don't tolerate it really well, but those are the ones, like some of those are there's some stuff in willow bark, which is like where aspirin is derived from. There's some of those products out there that are specifically for pain. And then you've got your capsaicin, some like the topical heat ones that you can also take internally. But again, how does people tolerate that? If they've got a leaky gut, or if something, they've got ulcers or something like that, some of those things will cause some irritation. And so then you got to look at, well, how do we lay these solutions together?
Yeah.
Right. So like if we've got a leaky gut, do we fix the leaky gut first? Well, yes, because some of the things may aggravate that same gut. Do we need to make sure that we've got L-glutamine in there, give them a good foundational support for the gut itself, and add some probiotics in there, when to load the probiotics versus, eating them with their food, timing, sequencing, all of those become important when you're using it from a therapeutic standpoint.
The more I talk about it, and even now, right, the way we're talking about it out loud, the more I'm like, how the heck does someone really navigate this on their own? Because with what we do, it's so nuanced of like, the body is a system. So if you're throwing the pill for every ill and you're throwing it at basically the the effect, not necessarily the cause.
Yep.
You have to support the foundation of why that's happening in the first place. It's like you said, well, maybe you have pain because you have a leaky gut and you're sensitive to foods, right? So we need to treat the leaky gut. Sure. Do we want to give them something to help acute in the short term to try to help it? Sure. But the idea of that is that I don't always think that because Western medicine doesn't necessarily look at the body as a system, it's looking at a lot of things in isolation, that the average person doesn't understand that we do need to maybe support various things to get this one end result.
Yeah, there is the trap of chasing symptoms with nutrition, just like there is the same situation with chasing symptoms with medication. And we can fall into that trap really easily because of course we want our patients and individuals to be able to have relief as quickly as possible.
Right.
Sometimes it's preparing that patient of like, here's the plan, here's what we're going to do, here's why we're going to do it, right? Here's the sequencing of how we're going to do it and the why, right? I know we've kind of hit that, like the what's your why question, but that it becomes is, okay, what are we trying to accomplish here, right? And if people are, depending on where they are on that scale of wellness versus illness, like there is a transition that you have to make coming out of, depending how deep you are, and it may take a while. It may take, may take 6 to 8 weeks to heal a gut, sometimes longer, right? Depending how bad the gut's beat up. Like you're talking people now with different illnesses like Crohn's and those type of things. That takes a minute for that gut to repair itself. I mean, the body is amazing in its ability to repair, given, all things functionally in where they're supposed to be. But it's, we're in a fix me now type of society.
Took 20 years to get there, but we got to fix it now.
I want to be fixed tomorrow, right? And that's kind of a lot of money for me to spend to try to do that. It's like, and like you said, 20 years, how much money did you spend eating at fast foods and, ingesting inflammatory oils and, go down the line. But it's kind of, because we are so resilient, it sometimes takes a long time for us to start showing the signs and symptoms of the illnesses, and again,
including on labs.
Yes.
Right. So,
absolutely.
Right, liver issues, you're not going to see that on a lab until you're well down the road. They're like, hey, my liver looks great.
Yeah. Well, and people all the time say like, my calcium and magnesium on my blood look normal. I'm like, if it didn't, you'd be in the hospital.
Yeah.
Right. So, but if they're still here, we're not seeing that. My friends that work in the hospitals, they're seeing that calcium and magnesium levels off all the time. Potassium dropped through the floor. Right. And so you've kind of got to have that understanding, right, of that, this is kind of like, hey, you're driving into that wall. You might want to turn over because when you hit the wall, you're in the hospital.
Right.
And it's one of those things, too, that we're talking about nutrition, but I mean, it boils down to, and I know that you and I have talked about this before, is like, how about your sleep? How about managing your stress level between your family and your work and your life, right? And what other self-care things are you doing before we even get into the nutritional aspect? And those become really important as well. And sometimes those are things that, again, that's the lowest hanging fruit because, again, there's no financial investment. It's just more of a investment in terms of strategizing your time, right? And your time management. And are you getting to the gym? Are you going to sleep at a reasonable time? Are you getting and meal planning and getting the nutrition on your plate? Like one of my favorite things when we talk about food being the first thing is I always ask people, what's their grudge eat food? And they look at me like, what are you talking about? And I'm like, what food do you eat because it's nutritious for you and you don't like it? And 99% of the time they're like, I don't eat a grudge eat food. And I'm like, well, your B levels and your energy levels kind of go hand in hand. How do you like liver? And they're like, it's disgusting. I'm like, okay, well, it's good, really good for you. And it's a really good source of B vitamins.
And you don't need much of it.
No, 4 to 6 ounces a week. And that's enough B for the whole week. And people are like, I don't want to do that. I'm like, it's not a matter of want. It's what does your body need? I don't like putting gas in my car at $3 a gallon, right? But I do it because I need to get to work.
And that's supporting phase 1 and phase 2 detoxification. So looking at what this deluge of toxins we're all exposed to, like there's not really a person on the planet. It's always like helps like, right? So if you can eat liver, and the liver capsules were eating liver, organ meats was part of our protocols, at the clinic. And people would fight, I'm not doing that. And we would give them, the alternative was that Ancestral Supplements does make, literally it is just freeze-dried liver inside of a capsule. So, but you have to take 6 of them a day. And if you're dealing with people with guts that are, you know, a little sensitive, can they do the 6 capsules? You could break it up 3 and 3, you know, and not take all 6 all at a time. But yeah, I would vouch, like for you, I think liver is so powerful. It is a true superfood, unlike, you know,
And
all the things that get labeled superfood, but that is a true superfood that I feel like everyone should have.
yeah, it's funny because everyone's like, well, okay, can I eat liver? Depends.
Mhm.
Because if you're have a situation where you can't get through your purines and you have gout,
That's true.
right?
You do have a lot of people with gout, and then
You
you're
can't,
struggling with
right?
that because the uric acid.
Because the
Yeah.
uric acid, right? And they
Mhm.
so then again, you've got to be aware of like if we do this, it's not just
Yeah.
go eat liver and have a nice day. It's like, have you ever had what's your history? Have you ever had gout?
Yeah.
Does any of your family have gout?
Mhm.
And so obviously I agree. Liver to me is like probably the number one. For me, it's the grudge eat food that most people could start with,
Mhm.
at 4 to 6 ounces a week. That being said, if they have any history of gout in their
Yeah.
family, they can't do that. So then everyone's like, well, then what am I supposed to do? Well, what did we say? It was B vitamins. There's other ways we can
Yeah.
get you a methylated B complex. Then all of a sudden you take that same person and they're on a methylated B that they respond well to, and they don't, oh, look at that.
Yeah.
All of a sudden things start turning around for them,
Yeah.
energy wise,
Mhm.
sleep wise, and all of the other things that go around just because now they have what their body needed for it to function well.
What's the most common issue you feel like that you hear that maybe either you're treating with a supplement or someone wants to be treated for? Like, is it pain? Is chronic pain number 1? Is sleep?
For me here, like a lot of it becomes pain,
Mhm.
musculoskeletal pain, obviously, as a chiropractic physician is what we see most of. It becomes a situation of that one again boils down to, again, what kind of falls into those, what the low hanging fruit for me is do you take magnesium, right? Do you
Yeah.
take vitamin D? What are your vitamin D levels? A lot of people now have been getting and checking vitamin D either on their own or through their primary care doctors
Mhm.
and the labs that are getting. And so like that is kind of being addressed. And so again, one of the things we're learning is that K2 taking it with D is
Correct.
very important.
I was going to ask you about
Yeah,
that because
so-
you were talking about calcium, and obviously that K2 can really help with the
Yeah.
calcium absorption.
And it basically K2 for layman's terms acts as kind of like the traffic cop.
Mhm.
It's getting calcium to go where you want it to go, back into your bones and into the places where you can utilize it, as opposed to calcifying like your arteries, right? And some of the other areas if you do have inflammatory situations going on where you have inflamed vessels and you don't want to be taking a boatload of calcium to
Yeah,
basically help
exactly.
lay down a bunch of plaquing and hardening of
Right.
your arteries, which then will end you up with some hypertension and on,
Yeah.
some blood pressure medication, or trying to figure out why did this happen.
Yeah, we were always very careful. Like, there were plenty of patients that would come to us where a doctor had recommended like a calcium supplement, and a lot of those patients would gravitate to like the bone and marrow, depending on what was going on, or the living bone. Again, those are from Ancestral. There are some other companies that
Yeah.
are similar that do things well also. Just again, the more we talk about it, the more I think, how would someone who doesn't know much, like say like my parents or even some of my friends, like how would people navigate this without help? Like it is really difficult. And I think that if you're listening to this, like lean on someone that you know and respect, in this field that can kind of at least guide you, and do not be afraid of testing.
To the original question, the other thing I'm seeing quite a bit of because of like the DEXA scanner and
Yeah.
the body composition thing, we're seeing a lot of osteoporosis. And funny enough, it's not always in females over the age of 40 that, are fair skinned. I'm actually, some males are popping and
Really?
I'm shocked, right? And of course you
Mhm.
would think, wow, why do they look like that? Like where
Mhm.
did your bone go, right? And they're as much surprised. And then you come out and you ask them a few more questions, like, did you drink soda? Like, what kind of soda do you drink?
Yeah.
And you've got, certain Diet Cokes, your Mountain Dews, they will literally, those habits, which you don't think much of, right? Like, oh, just one here or there won't kill me. No, but it will deplete your bone reserves pretty quickly. And I think it's shocking for some people when they see that. And again, boil back to the sleep and exercise
Mhm.
and nutrition. You need to have exercise. You need to load the skeleton for those nutritional products to be deposited back into the bone, because bone growth is key on having load,
Yeah.
right? So if you're not actually loading your spine and you're not doing the things to do that, and you're just working at a desk all day, drinking a diet soda here or there, you may be just melting your skeleton. You don't even realize it.
Yeah.
So again, back to testing, right? Like a DEXA scan or, like I said, we do have the body composition here, which will give you a DEXA scan number as well as your visceral adipose tissue and your muscle mass and those type of things.
Yeah,
so
that can be a rude awakening for some people. And I know for me it was. And like, I'll speak to the female contingency out there. If you are having the females coming in, and I'm using them for an example right now because obviously it's fresh in my mind because I've dealt with it and I have friends dealing with it. So I always like to speak to them in the podcast. Needing certain supplements, I just did it in my newsletter, just posting some supplements that are just helpful in menopause that we've seen. And I think that I was a person who was anti-hormone therapy at all, like total, like was like, nope, never going to do that. But you lose the protective benefits of estrogen. And so sometimes I think bioidentical in a small, I don't want the hormones of a 20-year-old, but like you'll see the heart numbers and the lipid profile will change even with people eating a healthy diet, right? You'll see that. You'll see even blood pressure changes or some plaquing like we saw like on my CT scan. And you're like, what? Wait, 3 years ago, there was 0 plaquing. Like, what is this? And then you look at the blood sugar and the baseline all of a sudden, again, eating a healthy diet is all of a sudden a little bit higher. So are there supplementations or things that you talk to maybe the female perimenopause or menopause crowd about for supplementation?
There is some good products from several different manufacturers that typically will combine different herbals, again, with some nutritional basics. I probably don't do as much of that. There is a couple products I can think of. Biotics just came out with a probiotic that's specifically for females, actually, for the whole oral vaginal tract, right?
So there's a lot of vaginal probiotics and things like that coming out now.
So they've keyed that in, and I know they also, again, just because that's a company that I usually deal a lot with, is they actually lowered their dosage of probiotics and found that worked, that had better outcomes when studied than using high like mega doses, which I thought was also very interesting, and have found that, again, people tolerate it better when you try to do that. Because sometimes when you're putting in that microbiome and trying to lay it over top of a gut that's just kind of dealt with a course of antibiotics or whatever, some people don't do well with it because they get upset, they get nauseous, sometimes even they get like vomitous and stuff. So it's like you kind of sometimes what we thought we knew, like to the calcium and vitamin D aspect, right? Like everyone's like, oh, throw calcium, vitamin D, magnesium, you'll build bones. We need a K2. Right. And it's like, okay, so now we've changed a lot of those things over like 30 years that I've been working. There's been changes. We've found things that we've adjusted. We've tacked one way or the other. I don't do a lot of calcium for people unless they are osteoporotic and I know they're not eating dairy and they're not eating green vegetables, and or they got a gut that doesn't want to kind of bring it in. You talk some about the other things in terms of some of the things I am using for both males and females as they get older. Sometimes if they've had their gallbladder removed,
see that a lot.
That you need to have a little bit of bile, right? So bile salts, right, when they're eating anything with fat in it, so they can absorb those fat soluble vitamins. Even sometimes if they're having some reflux and they've been on the train with the protonics or something like that to shut down the gut's production of acid, sometimes you have to give them that acid when they're eating a high protein meal so they can break down the proteins. And those are like nutritional supplements that people don't even think of. I'm thinking off the top of my head, one of my patients who actually was a general surgeon and takes out gallbladders on the regular, and he's like, well, they still have bile production. I said, yes, but it's dripping slowly like a bathtub. Like go have someone take a bath, right? And tell me how clean they get with the bile dripping in there, right? So you need a bolus of that bile to break down and emulsify those fats and those fatty acids and the nutrition associated with them so you can absorb them.
Well, the other thing that you can help with in that respect too is that a lot of times the gallbladder was just the fallout, but the problem doesn't always get fixed by removing the gallbladder because there's
no change in the diet, right?
There's no change in the diet, but the liver is involved in that too. Like sometimes that is just a downstream effect. That's the organ that took the brunt.
Right. Because it's like you said, the purifier, right? Like the organ is the great purifier. And if you've taking in a bunch of seed oils and you're taking in a bunch of refined carbohydrates and the liver is just and then there's some people that, enjoy the adult beverage here and there and the liver is just taking the brunt of it. And then maybe they're on some cold medicine or some sinus medicine that has acetaminophen in it, which is also beating up the liver, right? Then the gallbladder can sometimes take, like you said, the brunt of it. Some stones happen. One of those stones block it. The next thing you know, you yank it out because you got the acute pain. It solves the acute pain, but it doesn't solve what led up.
What happened to cholesterol in there. A lot of times those gallstones, there was obviously a bile issue before. So the hope is always that you see these things prior to it getting to that point. Not always.
Doesn't always happen.
Not always the case, but supporting the liver in this day and age is like a no-brainer just because of everything. And, in the autoimmune world, pretty much everyone you see is either single MTHFR or double. That's the double mutation. And for people that don't know that, that's like a methylation gene. And so that means it's impaired. And you'll see the women that can't detox estrogen and they have these symptoms, during their cycles that are just the most vicious symptoms. So like you were saying earlier, like an activated B that's methylated, like there's lot, pretty good case for like, why are we even giving ones that aren't methylated?
Yeah, it's like you said, the numbers are getting higher.
Yeah,
probably by the day.
By the day.
Yeah.
So let's give them some myths and money wasters. We wrote down some on here. Myth: more is better.
Not always.
Do you have a number that you're like, okay, that's a ridiculous amount of supplements, you need to cut that back? Is there a number?
Well, I think I'd be a hypocrite if I always tell people the average number of drugs that people are on at the age of 55 is 10. I've hit that threshold now in terms of age, and I'm on 0. So I think I'd be a hypocrite if I was saying that we should be on 10 supplements, right? Like, I'm a big believer is less is more, right? Get only what you need to, and it's to cycle certain things on and off. Like I said, it's probably 2 would be my number, maybe 3, depending if you're a normal, healthy person, and if you're stuck in an office job, we need to get you some magnesium. We got to get you some D, probably most likely, because you're just not going to be able to get it. And if I had to go down to 1, it'd be some of the magnesium products. And there's 7 different types of functional magnesium. So that's the other thing people need to know. There's magnesium orotate specifically for the heart. You've got aspartate and gluconate, which are more highly absorbable, and the list goes on. And so it's one of those things to try to figure out which one do you need, and if you can get a little, like, again, you need them all. Yeah. Right. Because different tissues, like magnesium threonate, right? Like, which is one of my favorites. Right. Like, game changer. Yeah. I mean, and it's showing studies on the brain, which is. It's breaking that blood-brain barrier. Huge. Yeah. Like, it's a huge, like you said, game changer. But it's like, and most people, when you say, oh, you need more magnesium, they're like, okay, well, I'll go pick up the citrate. And they're like, Yeah. And people are taking multiple magnesium. Like, I was taking multiple magnesiums. I would take a magnesium like malate, say during the day. Let's say I was doing a protocol or maybe doing some detox protocol. I take a malate during the day and then usually take the threonate at night. And then now I do think that a lot of females would benefit from a magnesium glycinate in their later years because of just the calming nature. And when you lose estrogen and progesterone, it can't not affect your neurotransmitters, and then comes the mood issues. Yeah, it's 400 different functions in your body plus that magnesium is responsible for. Yeah. And vitamin D is the same. Like, it's 400 plus different functions. And I think that's what makes, for me, those are my those are my go-tos. Those are, if people aren't on those, that's a good start for me. Like, everyone's like, well, what about a multi? I don't really what are you eating? Right? Are you fast food 3 times a day? Then maybe, we need a multi. But if you're eating if you're trying to eat a healthy diet, I shouldn't need to have to go in and cover over all of the deficiencies that are, coming from just a straight, standard American diet. Here's our next one. If it's natural, it's safe. Oh, the buzzwords, that's like a whole nother, that's like safe. No. That's like, I mean, just simply no. I mean, don't get caught in the buzzword trap. Some of the herbs you got to be really careful with. Really careful. Yeah, no. The answer to that question is, if it's natural, it's safe. No, cyanide, I believe, is a natural compound. All right. So is lead. And so is lead, isn't that? Right. So, yeah, that is a buzzword. They like to put it on, natural. Okay, what does that mean? Right. Like, the answer to that is no. And sometimes, I guess it falls into the supplement category now, which is the methylated blue. Methylene blue, yeah. Right. Like, methylene blue is a food dye, right? And it's a chemical, and it's a petroleum-based chemical. And I mean, the jury is still probably out on that. A lot of people are like, well, should I be taking it? I saw Robert Kennedy. I saw him taking it on an airplane, right? Yeah. And it's like, well, no, just because you saw someone do something, this is not. That's not for everybody. No. No, I've seen it, though. There's a doctor who speaks at our
He runs the Dr. Tony. He runs the Hope for Cancer Center in Mexico, and he's doing amazing things for cancer treatment. And he does use methylene blue with a lot of that. And I have seen some of the real, but again, like that's not one that someone should just be running out and jumping on and trying.
Yeah.
I would agree with that. And that's why those social media TikTok trends and things like that are a little bit frightening too, because people get on those bandwagons.
Well, there's
pretty
no
quickly.
Regulation, right?
Right.
Like
nothing to stop that.
It is completely unregulated. Like if you look at a standard bottle of like the nutritional label, right? And to pull on that natural thing, you'll see sometimes like proprietary complex, right?
Proprietary blend.
Or proprietary blend.
Yeah.
What's in that blend?
Mm-hmm.
You don't know.
Yeah.
And here's the crazy thing. If you're a college athlete,
yeah, you could, if it's not NSF certified, you could be in
big trouble.
Yeah.
You can be, not only that, if you're playing a team sport, your team could be in trouble too.
Yeah.
Right. So like for my daughter's situation, like I've got to be very careful of anything that I either tell her that she should be taking or provide her to take, because it's one of those things you've just got to be aware of it. And most people are clueless when it comes to that. And so when there's athletes and stuff in here at those levels or into the professional ranks, you have to be very careful that you're not giving them something that basically could end up disqualifying them from an Olympics or an event or one of their team events, because again, that's going to come back. And I actually, unfortunately, know of somebody in that realm that actually ended up with a year suspension. Thank God it wasn't from me. It was something that they experienced before they saw me, but it becomes quite serious. But so yeah, if it's natural, it's safe. No.
Yeah. I've had that angst with the athlete that I work with before. And I'm just like, I got to make sure. Zymogen, great company in that they do have a lot of NSF certified products for athletes to optimize performance, because that's even something we didn't really even talk about, is just how athletes optimize performance, but that's probably another podcast. The other myth is copying someone else's protocol.
Yeah, even for twins, we know that things are different, right? Like it all depends on, like, there's environmental exposures, there's where you're getting your food supply from, right? That we can talk in, that can lead to different things that would then have different nutritional protocols or basics even for those people. Like, I'm not going to take the same stuff you're taking, right?
You're certainly not.
And everyone's like, but what? Well, it's, there's certain aspects of things I just don't need them, right? Like, just like medications, you don't share medications, you don't share nutritional protocols.
And I would say that I can't think of a time where I've ever given someone a protocol without tweaking something. Like, say I know the protocol, this is how it's designed. And there are some supplement companies that are obviously great about giving protocols, right? But a lot of times you have to adjust the dosage, or there might be something in there that, and we think, herbs, they're not harmful, but like I've been at the clinic where we're giving them their supplements, and there's an allergy to ragweed, and there's ragweed in one of those supplements, and then they can't,
or a herb that's in the same family,
right? An herb that's in the same family, and all of a sudden they're reacting, and we think, oh, these things are 100% safe, but not always. Not always. I think we already addressed this a little bit too, but I'll review it for just so people remember. Is taking too many things at once with no baseline, which means like basically not having those fundamentals, those foundational ones. And then our other one is just the importance of reevaluating.
Yeah. Obviously symptoms are a big one for all of us, right? Like I just think of like, that's how most of us live, right? Where like, I woke up this morning, I'm stuffy, or am I not stuffy? Or like I was able to go to the bathroom, right? Or I went to the bathroom too many times, or if I didn't sleep well. Like those are all symptoms that we chase sometimes, like melatonin. People are like, oh, I love melatonin. I'm like, I don't.
But
it doesn't sit well with me.
That's a great example, because I have seen the cases where the people can't process that melatonin, right? And you're taking a small amount, but then you do a lab test and they've stopped it for days and it's still in their system because they're not. That's me. That was me.
Right, you couldn't process it out.
Can't process it out.
Detox it.
Can't process it. I think it's really difficult for some people.
And that's one that people readily run to, right? Because that's one of the ones for sleep that and sleep is important. We talked about that several 100%. Times already. And so they'll run to melatonin because they're like, I think I'm going to try some melatonin or chamomile, right? Yeah. And then you talked about ragweed and those type of different things. That if people are allergic to that herb, then that's not going to work for that person. And you
No.
have to kind of be able to know to tease those out. And that's, I guess, where the education part of it comes in to help, right? That's why it's like, okay, what do I need to know from that patient, or what do I need to know from the person when they're asking these things? Is this going to work for them and have no harm at best, right? And potentially work, or is it potentially going to give them a problem, right?
Right.
You give someone melatonin and it's like, if I didn't know you
Yep.
didn't process that, well, then I'm not helping the
Right.
issue.
And sometimes it's trial and error. We
Oh,
can't,
absolutely.
We're not going to know necessarily
There's
everything.
nothing that's 100%.
Right. We're not going to know.
Right. Sometimes
until
you
try
find, right.
it.
It's like,
Yeah.
when do you have any allergies to drugs? No, I have no known drug, right?
Right.
Allergies. And then all of a sudden they get a drug and
Yeah.
they found out they're allergic, right? Hopefully, nothing bad happens to them, but it's one of those things. Sometimes it is trial and error based on the information that you've gleaned from that patient. You're asking all of these questions, right, to try to tease out the information you need to give them the best possible protocol that you can put through for them nutritionally so that they can have the best possible outcomes.
Yeah. And I love the labs too, because what I love about the labs is you can see, like, a lot of things are like a flow chart, right? So if someone's deficient in GABA and they're right, but maybe they're 5-HTP and their tryptophan, like, you can give things upstream and try to get their body to produce these things.
Right, to function.
Yeah,
giving them raw materials. I mean,
give them the raw materials so the body can convert it. And then sometimes, like, when we look at stuff, we know what is required to make that conversion, which is lots of times B vitamins, right? Lots of times the B vitamins have
or magnesium.
Right. They have to be in there.
Yep.
So that's the difference between, working with someone. I know we sort of talked about this, but I'm recapping for people about how building a smarter supplement routine is starting small, the core supplements, layer in targeted support. And that's, again, when you're looking for targeted support for a system, even though it's attractive to some people because they're like, oh, that blend has X, Y, and Z, and I only have to buy 3 supplements. That sometimes when you're dealing with a symptom that you're trying to address, like, the dosage isn't high enough in the blends to actually get the result that you want. And then the last one is just how to prioritize what to spend money on, which I think we get. Did we get everything?
I think so.
I think we hit it all.
I think we did pretty good.
In less than an hour, too. How about that?
That's the first.
All right. Well, let everyone know, especially if we have our local friends here, how they can reach you and ask you supplement questions on social media now.
I'm at Quantum Care Medical Sports and Injury, and it's here in Ocoee, and 321-234-8900. And you can also shoot emails to drsidorsky@gmail.com. Those are probably the 2 best ways to get to me. I am on Instagram, and I don't know if I'm public on it anymore.
You're not public?
I might not be public on it.
Well, they're going to request
Facebook, I have my public, Dr. Sidorsky, is still public, yeah.
Okay, there you go. So then he can ask you, now they're going to send you a bunch of supplement questions. Thanks for coming on. I don't know how we skipped a season, but it's nice to have you back.
Oh, thanks for having me again.
That's a wrap for this episode. If you enjoyed the podcast, I'd love to hear from you. Connect with me on social media. I'm Whole Health Kristi on Instagram, Facebook, and TikTok. And let me know what resonated most or what you want to hear in the future. You can always find full show notes and past episodes at kristihujik.com/podcast. Please take a moment to like, follow, review, and share the podcast with anyone who might benefit. A quick review on Apple Podcasts goes a long way in helping me bring more of these amazing guests your way. Stay tuned for the next episode of Ripple Effect Connection. Together, let's create waves of change.